Hello everybody, this is Greg Stock, CEO of Thibodaux Regional Health System. It's a pleasure once again to be back with Dr. Trevor Johnson. Dr. Johnson is a very well-trained young physician who recently joined the medical staff here, originally from New Orleans and knows the area well. A guy that knows good gumbo when he eats it.
That's right.
Dr. Johnson. And is a pain specialist, meaning he medical school, anesthesia residency, a number of years, and then a pain fellowship beyond that training to give you that special expertise. So today we're going to talk for a moment or two, or get Dr. Johnson to discuss a little bit of a common problem that people have with pain, and that's lower back pain. You want to discuss that for a moment or two, Dr. Johnson?
Sure, yeah, of course. So my favorite thing as a pain doctor in general is when I tell people what I do for a living, they always assume that, oh, we're just throwing pills at patients, throwing these narcotics and dangerous opiates. But what I love is expressing to them, hey, we have so much more to offer these days, specifically with low back pain. For example, one being what's called lumbar spondylosis is a very common diagnosis, essentially arthritis of the lower back. So we have patients who've been suffering from this for years without being even aware that we have interventions to do for those. The biggest that we do is called a radiofrequency ablation, simply a fancy word for saying nerve burn. So we essentially locate the arthritis in most patients' lower lumbar spine. We test those with some lidocaine to see if they get some good relief. If they do get relief from that procedure, we then transition to the radiofrequency ablation, which doesn't kill those nerves, doesn't destroy them. We essentially calm those nerves down for at least 6 to 9 months of relief. And
great, wow.
Do these outpatient, very similar, very simple procedure, and we tend to get pretty good results from it.
It's awesome, man. So it's almost, here's a problem, and you zap the problem, and there's pretty much an immediate positive reaction.
Exactly. We're instead of masking the pain with medication, we strive to kind of go fix the problem and not just mask it with medication.
So many people that have back pain and have, as you said, struggled with it for years, and go to work with it and try to play ball or some activity that they like, simple things even that they kind of miserable at.
Definitely.
Where they sit in their car and they've tried exercises, they've tried this or that without great results. So it's wonderful that you're here and you can help people with back pain. Definitely. Anything else you would like to say about it?
I guess I would say my favorite part is knowing that I'm making that difference in people's day-to-day life. When patients come back and say, I'm able to play with my grandkids or I'm able to pick my grandkids up, that's kind of the response of functionality increase that I tend to go for. And that's what we're here for, to live life the best way we can.
I love it. It's a very important work, and we thank you again for joining our staff.
Oh, I'm happy to be here. Thank you.